approved the Pfizer and BioNTech vaccine in record time. Speaking at Downing Street, the Prime Minister called it a momentous moment. An election official in the US state of Georgia is pleading publicly with President Trump to dial down the rhetoric levelled against his colleagues over the election results. Some are receiving death threats. Mr. Trump is angry that a second recount has made no change to Joe Biden's victory there. One of the most influential European politicians of the past half century, the former President of France, Giscard d'Estaing, has died. He was 94. His family say he died of complications linked to Covid-19. Rolling out the vaccine, of course, will be a huge logistical exercise. It will also be affected by a post-Brexit deal, as the supplies will come from Belgium. Our health editor, Hugh Pym, explains.
The NHS is ready, though it's a huge task starting next week, vaccinating first its staff and other priority groups. And those likely to receive the jabs, including nurses who went through the first wave, know how important that is.
As working as an ICU nurse, especially in the first surge, a lot of the nurses were living away from home and they were concerned about bringing it home to their families.
If we do have the vaccine, it means we can get back to living a more normal life. Life has not been normal for the past several months.
The official first phase priority list is headed by care home residents and carers, followed by the over 80s and frontline health workers, then lower age groups and younger adults with health conditions. But it'll be NHS and care staff and the over 80s who actually get it first. Health leaders say hospitals will be the focal point next week.
The idea for the first phase is that we concentrate on NHS hospitals delivering this vaccine because of the particular requirements of the Pfizer vaccine.
But care homes are now wondering what all this means for their residents and why they don't now appear to be top of the list.
It's really disappointing, and obviously there's potential implications for our residents as well. Should we get another outbreak of COVID, then they're more likely to suffer some serious consequences of that.
One reason is the way the doses are packed. It's emerged that approval by regulators is still required to allow them to be broken down into smaller consignments to be taken into care homes.
As soon as we have the regulatory sign-off that we can do that, we can get the jabs to the care homes so that the GPs and the nurses can then arrive and give those care home residents that COVID vaccination, we will do that.
In Northern Ireland, officials have set aside a new hospital emergency department as one of 7 designated vaccination sites. The Scottish Government also plans to prioritise health and care staff.
The first vaccines against COVID will be administered in Scotland on Tuesday the 8th of December. So you can perhaps understand why I've probably smiled more in the last few minutes than you've seen me do in several months.
There's now an accelerating drive to set up vaccination hubs for the wider population, including one at Epsom Racecourse. Even a village hall in Surrey is being prepared as a site for vaccinations in the local community. The new vaccine is on the way from Pfizer's Belgian plant. It's a shot in the arm for ministers. They'll hope that Brexit doesn't affect the continued smooth running of this vital supply chain in the new year. Hugh Pym, BBC News.
Just gone 1:30 in the morning. Time now for the travel show.